Good afternoon. And today we have a pleasure of interviewing Dr. Jessica Lendenhausen, my friend, and a public advocate and an author of the book Oral, what I really enjoyed reading recently. So we can see the book in the back, and Jessica has it as well. And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, this interview would be great for you because we're going to talk about little habits what you can develop to improve your oral health as well as overall health. And if you're a medical professional and you want to help people who have trouble sleeping, this interview would be for you because we're going to equip you with some knowledge and a little tips what you can use for your patients. But also, we're going to talk about very hot topic, how to make your breakthrough idea heard. Jessica wrote the book, and that inspired me. Um, to follow her steps. And I'm sure a lot of you have idea what you want the audience to know about. And we're going to talk about that process. But now I want to introduce Jessica. So first of all, good afternoon, Jessica.
Hi, Maria, and thank you for having me. This is so much fun.
Yes. And Jessica is a dentist. She's a public health advocate. And as I mentioned, she's author of the book called Oral. This is a Swedish secret to full body health, starting with your mouth. And she talked in the book how small changes, how we eat, sleep, breathe, and move can improve overall health. And we're going to talk about her wake up call, what she did, what changed the way she approached overall health for her, and what she teach her clients. Jessica also helped other people to establish healthy habits for life. But this is my story with Jessica. We met through TED. We are both really passionate about technology, education, and design talks. And Jessica was a host for many years. She ran her TEDx, um, I would say,
Chicago.
conference, TEDx Chicago, TEDx Chicago conference, and she selected speakers for the conference and make the audience feel excited and inspired with ideas. We're going to talk about that process. Maybe some of the people in the audience, I know some of the people in the audience want to have a TEDx talk for them. So Jessica going to share the secret how to get on the TEDx stage with your breakthrough ideas. So my first question to you, Jessica, tell me the story about the book. What inspired you to write this book?
Well, yeah, that's a good question. But I think it came from me being so passionate about figuring out how to live a healthy and happy life. And then, as I was a dentist as my background, I take the view that health starts in your mouth.
And can you give us a short overview of the book? I read the book. I really like the book, but I want my audience to know what is this book?
Yeah, I'm trying to give the reader practical solutions for everyday life so they can proactively create small new habits around eating, sleeping, breathing, and moving, which will for sure enhance both the oral and overall health in one way or another. And I also use the Swedish word lagom, which means not too much or too little, but just enough for you. And it's very personal. So you can tell me, I guess you're in New Jersey and I'm not. So I would ask you about the weather. You might say it's lagom warm outside today. And I would, as a Swedish person, think I understand what you mean, which is so funny because no one can know what it really means, but that's how it is. So lagom is good.
Yeah, the lagom is that word. I would say equivalent to the word balance in a way,
Okay, yeah.
right? We can say that it's
Yeah,
not
but
too
I
much.
think, but I always think you don't want to overdo things so you don't keep it sustainable. You want to do just enough of whatever it is you really want to do to make it happen.
Yeah, that's a beautiful way. I also want to mention another thing about Jessica, what made me wow. That would be your golf championship. And I know you talk about moving habits in your book. So you really, I would say, excel in that way, being the champion for golf in Sweden, right?
Yeah. Well, and yes, I not yes. And
Mm.
when I was writing the book, I actually took a lot of walks to just talk to myself, and then go back to the driving the computer and do my writing.
Yeah, so moving really helped the thought process. But now I'm going to ask you the practical way. What in your book, can you explain to us what's the connection between oral health and overall health?
So I see it goes both ways. So you can have the connection that the mouth can be sick. You have diseases in the mouth that can go out to the body, which we know for years, and now we see more of those. So that's one part of it. And the other part is that you can enhance your oral health by having good foundation in your breathing, eating, sleeping, and moving. And do you want me to explore more there maybe, or no?
Yeah, it would be.
Yeah. So everything comes down to the microbiome and the pH in the mouth. And every time you put food or drink in your mouth, it changes the pH, which makes the microbiome get a chance to attack the teeth or the mouth for disease. But you have your built-in cleaning system, which is the saliva. So that comes to work. But if you keep it coming too often, the saliva doesn't have time to do what it should do. And that's sort of a short version of what goes on. It's a balance between everything.
Yeah, that's nice. So people have to really have a proper system. And I would like to ask you about that proper system. In your book, what you describe as the 4 pillars of health to have a sustainable, healthy way of living, what start in the mouth. Can you please talk about those 4 pillars?
Yes. So I did research around, or read a lot around sustainable healthy habits before I came to write the book. So I came down to, and I think it is breathing, sleeping, eating, and moving that keeps us going. And let's start with eating. As I said, snacking is not what you should do if there's nothing that you have to do for other reasons. But that is one thing to look at and always see what's going on with that for yourself. Then I think the sleeping is one thing that we have tried to be heroic about and not sleep. So I think that's the thing. You should take your sleep seriously and so you have a pattern, and not totally antisocial, but you should have it at least when you go to bed and when you wake up, very similar every day. That goes a long way. And then we have the breathing. The nose is made for breathing. So there are ways to breathe more properly, which includes the rhythm and the belly breathing and your posture, actually, which comes closer to the facial things that comes along. And nose breathing has such great effects too that I can talk about later maybe.
Yes,
and moving is always good. And the moving is always good for your overall being, just small or big. But that's one thing you should make sure you do every day in one way or another if you can.
I read a lot of books. I read constantly, but I would say that your book is very reader friendly. It's in a very simple, easy to digest way people get fundamental knowledge. So thank you very much for that. I also want to ask you about a practical thing. What was your actually wake up call? Why you decide to become a healthy? I know you all want to be healthy, but I don't know. I would put it, change your small everyday habits to
okay, I get it. Yeah. So for me, when I before I started writing the book, one thing that got me going really was that I had receding gums, and I thought I was taking care of my mouth for sure. realizing there are other things than actually cleaning your mouth that makes the mouth help. So I went to a specialist to see what could be done. And I realized when I left, or rather ran out of there, that we had totally miscommunicated. He, with good intention, probably thought I wanted to look good. And I wanted to be healed and learn what to prevent in the future and not have surgery, rather. And that was a wake-up call, realizing that first of all, that I didn't communicate what I wanted, and maybe other people do the same. And the second is to give people now through the book a tool to ask the right questions when they do sit in that chair that I did. And I knew that sort of the questions, but I didn't have the mind to ask. But that's what people should do. What does this mean? What's next, and what happens, afterwards, etc.
So I would rephrase your your speech, and I would say that book is actually a tool to have a better communication with the health professionals, because in my everyday life I'm trying so hard to explain to my patients a lot of things, but we're not on the same page. That whatever I'm trying to explain to them, they want to hear something else. So I think this book, we can call it, can be a great bridge between health professional and the patient.
That would be wonderful. Yes, that's what one thing I really want.
Yes, educated consumer is our best customer. I always say that to my patients in a humorous way, but that's what it is. I would like to ask you from a different part of your life, as being as a TEDx host, since a lot of people would love to make their idea heard. As a TEDx host, what criteria you use to select people for your program? What was important for you?
So, well, I think all the TEDx organizers think similarly. That is, that we're looking for the best ideas out there, and it's told in a new way, or a new idea would be fantastic. Some ideas are not new, but it could be different anyway. So the thing is that I had 400 applications a couple of years, but you really need it's a show that we put on as well. So there are multiple layers of how we're thinking. So you want to have very different ideas on the stage. So sometimes it could be someone who has a fantastic idea, but we already decided to have another person with a similar idea. But it's the depth, and if you either lived the idea or you have research about it. So it's very serious work behind it and experience.
So basically, the person have to have a lot of research behind it, or maybe professional experience, but not only. He has to present the idea, and I would say very polished, easy to digest way.
Oh, no, but at least TEDx Chicago worked with the speakers. So and I'm a speaker coach, so we create the talk with the speakers. So you don't just take your presentation or your keynote speaking presentation and make it shorter to fit in. We create the TED Talk, which is different than presentations.
Yeah, and now I'm going to ask you, in the same realm of question, what it takes to put your idea on a page, to write the book? Can you please tell us about your journey?
Wow, yeah, it's a blur almost afterwards. I don't know how it even came together, but it did. So I spoke with friends, of course, and asked those who've done it before me, and I got some great suggestions. And I found a wonderful lady who worked with me to do a publishing proposal, which meant I had to really, really think through what the book would be about, and how, and for whom, and why. So when I did go back to work on specifics, I had actually I had a friend of mine in mind. So I talked to her. She doesn't even know this. Talked to her when I was writing. Would she think this is something worthwhile listening to or reading? And if I felt no, she won't. Boom, out. Start anew, or write it differently, or write it shorter, or tell a story instead. So that was a good way, because then I had a conversation in my head with someone else when I was writing. And then I, of course, had heavy editing, moving things around, which was fantastic to feel, wow, this is getting much better. I don't know how they do it, but editors are amazing. And then I had an idea how I wanted the book to look. And I'm so happy to hear that you say it's digestible, and that was the goal. And luckily, the editor and designer they understood what I meant, I think, and appreciated it. Because partly they didn't know much about the topic. So when they read, it was important that they would understand. So that was also a checkpoint in a way. Yeah.
So basically, how long it took you to write your book?
I know I started 4 years ago when I decided. It was the dentist office visit I told about, and also a girlfriend of mine whose dad was so sick for months in Sweden. They tested him up and down and all over, and he was very worried. And after all those months, they came up with that he had an inflammation in a tooth, or an infection. So those two things got me going, and then I just sat down, and now I have to do this.
Nice. That's a great way. Thank you very much, Jessica, for sharing all your insight. We really appreciate it. And I highly recommend to my audience to read your book. Or we're going to put information about Jessica's social media channels, which I find really practically useful. I really enjoy your Instagram with all these little advices. And I forgot to mention, in the book, you can also find some recipes. And Jessica is a famous great cook. So those recipes are really good. And they with a Swedish accent. So they European, mix. So they're healthy and delicious. And on top of it, information about the book, information about Jessica's social media channel, you can find on the bottom of the interview. And I hope my audience get as much wisdom from your book as I did. So thank you very much.
Yeah, thank you for having me, Maria. Always fun chatting with you and seeing you.